Tenecteplase versus alteplase in acute ischemic stroke patients. What are thrombolytic medications? Thrombolytic medications, such as a tissue plasminogen activator, also known as TPA, or tenecteplase, are utilized to treat an acute stroke or heart attack. In present-day healthcare, a tissue plasminogen activator is the most commonly used and only FDA Food and Drug Administration approved treatment for acute ischemic stroke. Other medications, such as tenecteplase, have similar effects but do not have approval from the FDA to be used in the clinical setting. These medications should be given within the first 30 minutes of hospitalization for the acute ischemic stroke or at the very beginning of treatment in order to reach its highest potential. How does TPA, a tissue plasminogen activator, work? One of the most common types of strokes to occur is the ischemic stroke. Ischemic strokes happen when a blood clot occurs in the brain, constricting blood flow to a specific area. Tissue plasminogen activators work in dissolving that clot in order to restore blood flow as quickly as possible. If these medications are given within the first 30 minutes of beginning treatment, after effects of the stroke will be less of a risk and risk of damage will definitely decrease. Some signs and symptoms of ischemic stroke can be remembered by using the acronym BFAST. Balance for B, I is for E, F is for face, A is for arms, S is for speech, and T is for time. TPA versus tenecteplase. There are many similarities between TPA and tenecteplase, both having similar chemical components. Tenecteplase is a newer drug to the healthcare market and has been proven in the early stages of testing to be potentially a safer alternative with a higher rate of effectiveness on acute ischemic stroke patients. Preliminary testing of tenecteplase in patients with acute stroke has been encouraging enough to warrant further testing. Tenecteplase, while showing signs of a possible higher effectiveness rate, is also more cost-effective as well, costing almost half the cost of other medications on the market. According to the article Tenecteplase versus alteplase for the management of acute ischemic stroke in a low-income country, Nepal, cost, efficiency, and safety when treating ischemic stroke with either tissue plasminogen activators or tenecteplase, one has not been proven yet to be safer or more effective than the other. Further testing is still encouraged to uncover this possibility. Comparing the two. While there are some evidence that needs further research, it does seem that tenecteplase will be able to be utilized as an alternative to alteplase in the future. Both drugs showed no differences in the safety of administration. Tenecteplase did show a higher rate of effectiveness in some studies when looking at data of individuals with acute strokes in early neurological assessments. If tenecteplase is to be used in the future, it will also save money as it is just about half the price of alteplase with the same and if not better rates of effectiveness. Tenecteplase did not show any signs of harm or negative effects on acute ischemic stroke patients. Planning to implement my research into practice. As a member of the Stroke Committee, it is important to share new and upcoming ideas to improve patient care throughout the hospital. Sharing of the research found on this topic can not only be beneficial to the stroke unit, but can be utilized by doctors and other healthcare professionals in order to help boost the standard of care all over. Sharing this information with the committee will also open up the floor to discussion on this research and topic in order to exchange knowledge and ideas while also spreading and furthering everyone's education on the treatment of strokes, especially acute ischemic strokes. I can also share this information with the certified stroke coordinator who visits our unit often in order to have her spread the information further. Barriers to implementation. A common barrier to the implementation of this found research can be seen as the ability to find doctors and healthcare professionals willing to look further into these findings. Many healthcare professionals do not like to venture out from their traditional practice. In order to overcome this, I will share the most information possible on this topic and give examples on how to implement this into practice and the outcomes of this research. Using internal evidence. When it comes to internal evidence, immediate effects of stroke treatment and longer-term effects can be researched on the unit where I am employed. Being a registered stroke center, finding this information will be easy since such a high population of our patients are acute stroke patients. We can compare times and interventions to the treatments used over a specific course of time to see the best outcomes. My theoretical framework. When creating a theoretical framework, you want to show your problem statement and research questions. My problem statement is, TPA is the only FDA-approved treatment for acute ischemic stroke. The objective of this framework is to explore other treatment options for acute ischemic stroke. My research question is tenecteplase another reliable source of treatment for acute ischemic stroke? And if so, how can we integrate it into professional practice? The concepts of alteplase and tenecteplase are significant to the healthcare world in finding the best possible treatment for acute ischemic stroke in its immediate stages. The overall goal of the study that I looked at was to compare the usage of alteplase versus tenecteplase in those suffering from acute ischemic stroke within 4.5 hours of the onset of symptoms. The results of this study show that tenecteplase has similar, if not exactly equal, effects on the types of patients as alteplase does. In this study, they measured results through following up with these patients post 90 days after receiving one or the other first-line treatment methods through measurements of post-thrombolytic bleeding, functional outcome after 90 days post-treatment, and recanalization and reperfusion rates post-treatment. In order to complete my research and come up with a summarized presentation on my findings, I used an abundance of resources and literature reviews found through Google Scholar. These are the following references that I included in my research project and in finding the information that was presented to you throughout this presentation.